name is Holly Schechter. I'm a high school English teacher at Stuyvesant High School in Manhattan. Exactly 43 days after my wedding, I was driving with my little brother on Cape Cod. I was visiting him. He was a jet ski instructor for the summer. And I was taking him for a haircut and to the laundromat because he was a mess. And we were rear-ended by a wildly drunk driver. So that was how it all started. I was obviously like a healthy, normal, active person up until then. And then the accident caused pain that didn't ever get better over time. It just got worse and worse.
Holly was an interesting case. She was involved in a motor vehicle accident, and she came in and she had this sort of devastating injury, and she had severe pain both in her neck, going down her arm, as well as in her lower back.
I have always been an incredibly active person.
As you can imagine, and somebody who's young, and she's a teacher in high school, and so she needs to be on her feet and be very mobile, and she was just unable to do her day-to-day things.
Even laying down hurt, which is problematic. If laying down you don't even find comfort in.
We really, tried to get her better with things like physical therapy, medications. We sent her for multiple injections. Unfortunately, those things just didn't provide lasting relief.
The reason why I was drawn to Mount Sinai initially is when I was struggling to find resources who could help me. I looked to my New York Magazine Best Doctors issue, and I loved that this is a teaching hospital. As a teacher, I knew that I wanted to be in a place where people would take time and explain things to me.
What we found was that, she had a very, very collapsed disc between the fourth and fifth vertebrae in her lower back. And what that means is that, the function of the discs is to act as a cushioning between the vertebrae. And in her case, one of those discs, which actually takes a significant amount of the load, the one between the fourth and the fifth vertebrae, was no longer functional.
My first appointment, Dr. Quereshi spent almost an hour with me. He pulled up a stool and sat down and talked me through everything for a really long time, and I left knowing that, still not thinking it would come to surgery, but knowing that whatever the case was, I just felt positive coming here.
At the end of it all, Holly said, all right, I really need to have something done about this. I can't go on living like this. It's really, taken over my life. And we had a decision to make. The traditional procedure for Holly's problem is called a fusion, where we sort of, in layman's terms, glue the bones together. In Holly's case, because she just had issues at one disc, and given her age and her proposed activity level, we performed a procedure called a disc replacement. He
actually gave me two choices. He gave me the option of fusion or disc replacement, and left it to me to make the final decision.
And in a disc replacement, what we do is we make an incision just under the belly button, similar to an incision that a woman may have for a C-section, but smaller. And that gives us direct access to the front of the spine. And what we're doing there is we're actually removing that disc that's no longer functional and putting in a new disc. And it not only takes the pain away, but it allows patients to regain motion that they've lost because they no longer had a functional disc.
He also came in and showed all of us a photograph, an image, so I could see what it looked like inside my spine with this prosthetic disc.
She immediately felt relief of pain and was extremely excited. Her post-operative course was really, taken up by getting mobile again.
Dr. Quereshi came to my room every single day, even over the weekend when I was there. The vascular surgeon came every single day. I really never felt like, okay, we operated on you, we're done, moving on. So that was a really nice feeling. My expectation for my own recovery, of course, my hope was that I would be as I was before.
Within about 6 weeks, she was on a treadmill and in the gym.
I was at home for about a month, and then I did a month of physical therapy post-recovery, and then I started working out 2 months post-surgery.
One of the things that she really enjoys doing is swimming, and she was back in the pool. She really, had an amazing recovery.
I went right from my 6-week appointment to join the pool the second he gave me the go-ahead. And then I started doing some gentle yoga 2 weeks after that. And now, 7 months later, I can box. I can run, I can swim, I can do yoga.
It was a real home run in terms of her recovery. But the good news is that she's back to work. She's off of all medications and essentially has found her normal life again.
What does Dr. Quereshi mean to me? Second to my husband, he is the love of my life. He saved me. He made me feel calm and he made me feel confident when I didn't feel those things on my own. I am so appreciative and grateful for all of that.